Welcome to this edition of Versant Spotlight Series, where we engage healthcare thought leaders on important issues facing healthcare and the profession of nursing. I'm Michael Carmen, Managing Partner of Versant and founder of Versant Center for the Advancement of Nursing. And I'm pleased to host this edition of Spotlight.
Well, meaningful recognition is all about giving recognition to individuals that means something to them. Somebody might be working on their master's degree or their undergrad degree, so we would provide gift certificates for books for them. So we wanted to make it extremely important. And then as the pandemic progressed, like many of us, we put up many things on pause. And then we realized we needed to get back to doing what we do. It was time to just pause, to recalibrate. We had to get back to the ritual of recognition, and that it should never stop.
So in addition to the direct care nurses that we started the Daisy Foundation with, we're honoring nurse-led teams, we're honoring nursing faculty and nursing students. We're honoring lifetime achievers, those nurses who've dedicated decades of their lives to taking care of patients and families. Having said that, though, of course, we've had to get creative, but especially our hospital partners have gotten really creative in how they have sustained Daisy. Just as they are socially distancing in their healthcare facilities, nurses are now, we get pictures of nurses who are in full PPE and yet are and standing apart from each other, and yet are going through that ritual of recognition or having a Daisy Award ceremony. Our Daisy committees, who do so much work to ensure that this process is ongoing, are doing a great job virtually by having their team meetings to select Daisy honorees via Zoom or whatever, and they're keeping it going without sitting in a room together close up having to evaluate the nominations they receive.
It also helps take our workforce to the next level. It increases patient safety. It increases collaboration and clear communication. So across the board, Daisy does so many different things to help us treat our patients, our families, as well as build the competency and the camaraderie of our team.
When you attend a Daisy Award celebration and you read the story aloud of what a nurse has done for a patient and family member, those stories become role models for everyone, and I think they're so elevating. And at the same time, we know from research we've done that patients and families who, of course, we know want to say thank you. I mean, more than 2 million people have written nominations so far for the Daisy Award. But it means so much to them to be able to, number one, describe the extraordinary experience they've had. They want to talk about it. Secondly, it means a lot to them to be able to give back to their nurse. So as a patient who's been on the receiving end and been so vulnerable in a nurse's care, now can say thank you in a very meaningful way and give back to that nurse. And third, we know that when a patient gets to write a nomination that is so well received by a nurse, it also helps to bond them, the patient, to the organization. It transcends the moment of their writing that letter of gratitude. So everyone is benefiting from this. The organization, of course, for all the reasons that Jeff just stated so eloquently, the nurses who are so engaged, and even patients and families who get to say thank you in a truly meaningful way to the nurse who gave them so much.
Well, I want to thank both of you, Jeff and Bonnie, for this conversation. It's enlightening and it's heartwarming, and thank you so much. We're going to let Jeff go now, but Bonnie's going to stay with us as we do a deeper dive on maintaining and enhancing meaningful recognition at Martin Luther King Jr. Hospital. Thank you so much.